All right, we are going to give everybody a minute to get settled in, and then we will begin today's seminar. All right, so hi and welcome to the Conversations About COVID seminar series. I'm Jessie Burke, Associate Dean for Academic Affairs and faculty in the Pitt Public Health Department of Behavioral and Community Health Sciences. If you weren't able to join us last week, I encourage you to visit the Pitt Public Health COVID-19 webpage to review the recording of Wendy Braun's presentation from last week. She's now in the role of the COVID response coordinator for Pennsylvania and really has some unique insights into the state's efforts. And I learned a great deal from her presentation. So if you didn't get a chance to see it, the recording is there and I encourage you to go view it. I also want to say a quick thank you to everyone who sent ideas about what we should focus on for the last seminar. So that's next Friday. Based on your feedback, next week, we will have Assistant Professor of Medicine, Jamie Sidani, and Professor of Political Science, Michael Kalsari, will join us with our own BCHS PhD student, Beth Hoffman, to discuss ways that public health can address dis and misinformation in the era of COVID-19. And with a particular focus on the implications for the COVID-19 vaccine acceptance. So that will be a really exciting way to end our seminar for the fall. All right, so now back to today. The structure is the same. I'll introduce some introductions. The speakers will present, then we'll open it up for questions. Please use the Q&A function to ask your questions and I'll help to moderate. We are recording this as a reminder, and it's now my pleasure to introduce our guest speakers. So Marianne D'Alessandro has served as the director of the National Personal Protective Technology Laboratory at the National Institute for Occupational Safety and Health, or NIOSH, since March of 2012. Prior to that, she served as Associate Director for Science at the lab for 9 years. She provides leadership to the NIOSH Personal Protective Technology Core and Specialty Program and the Public Safety Program, where she serves as manager, leading the effort to align PPT, or Personal Protective Technology initiatives, with user needs across all workplace industry sectors. Within that program, she served as the catalyst for aligning surveillance, research, standards, certification, outreach, and intervention activities to improve workplace safety and health. And prior to joining NIOSH in 2003, she had a short academic career at the University of Pennsylvania's Department of Bioengineering and served in various US Army research and development organizations for 15 years. Our second speaker is John Powers. John is the Supervisory General Engineer and Branch Chief with the Evaluation and Testing Branch at NIOSH's National Personal Protective Technology Laboratory. He's worked at NIOSH for 23 years. Prior to that, he worked for a number of years for the Department of Defense. His background is in electrical engineering, and he has actually published several articles related to the development of engineering controls to protect workers. Since the COVID-19 pandemic started, he's been dedicated to evaluating and testing international respirators, as well as working with several federal agencies investigating counterfeit respirators. So I'm really excited to have them both here today. This is a topic I know very little about, but I'm very interested in learning more. And I will turn it over to Marianne, who will start our conversation about their response to the PPE challenges during COVID-19. So I'll stop sharing here. And John, if you want to go ahead and share the presentation.
Okay, great. Thank you, Jessica. It's great to be here this afternoon, and thank you all for sticking around on a Friday afternoon. You may not know, we are located in the South Park of Pittsburgh, right in your backyard, co-located in South Park and in Morgantown, West Virginia. I'm in South Park and John Powers is located in Morgantown, West Virginia. We have a lot of Pitt grads who come to work for NPPTL, so maybe after some of you hear what we do, feel free to reach out to me or John, and we'll see how we can collaborate in the future. We also have some of your staff members who actually are working with us right now in some of the departments and statistics and in some of the emergency services groups. So can you go to the next slide, John? So first of all, for those of you who are not familiar with NPPTL, we are the division in the National Institute for Occupational Safety and Health that focuses on personal protective equipment, conformity assessment activities, research on respiratory protective devices, and other types of personal protective equipment and outreach and communication efforts. So NIOSH is an institute within the Centers for Disease Control and Prevention, and CDC, as most of you know, is part of the Department of Health and Human Services. So can you go to the next slide, John? So the first area of emphasis I want to talk about today is the respirator conformity assessment activity, which is the cornerstone of NPPTL. And the conformity assessment program has three components. It has respirator approval, post-market, and standards development. And during our conventional operations, when we're not in an emergency response scenario, we approve all respirators that are used in occupational settings in accordance with our regulations. Some of those you can see around the perimeter of the Cornerstone, and that ranges from anywhere from those filtering Facepiece respirators, or they look like masks that are worn by healthcare workers, to the elastomeric respirators that are the rubber device with the filters on the sides, to those devices that are used by firefighters, the self-contained breathing apparatus, and the mining devices that are the self-contained self-rescuers. So all of those are approved by NIOSH. So it became evident early on in the response that our efforts needed to be ramped up with our approval operations, because there were significant shortages even before the COVID-19 pandemic was declared. Manufacturers were reporting about 2 to 3 times their typical sales, and healthcare institutions at that time were bracing themselves for a pandemic very early on. So we saw the same thing happen during the Ebola response, when panic purchases result in shortages, and then also this happened during H1N1 as well. So we had experienced this in the past, so we were somewhat prepared, but this was very unprecedented. So to address the increase in sales, the respirator manufacturers began to explore options to increase their production capacity. So when they do that, they have to come to us and say they want to, get a new site in place, or if they want to bring some old production lines back to market, and if they want to revive previous production locations. So all of that results in them having to come back in and get that approval modified. So all of these actions, plus an influx of new approval holders, because there were a lot both within this country who wanted to help out, and then there are also many from overseas who wanted to bring new products to market. We've had over 1,000 inquiries regarding having new respirators approved in the United States. And we're an operation of 100 people. So during routine operations, we typically make about 30 respirator approval decisions per month. And the process for a filtering Facepiece respirator typically takes about 60 to 90 days. And during this response, we didn't have that time. And the approval process includes both rigorous quality assurance review, and it also includes testing as well. You can go to the next slide, John. So to address the evolving response and the expected increased need for respiratory protection across healthcare, we took multiple steps. First, we shifted our operations from 5-day, 40-hour work weeks to 7 days a week around the clock. And we added a few additional contractors to support our effort as well, and brought in some old employees also. We also made a strategic decision to process applications that were only focused on respirators that were used in healthcare settings. And those are the filtering Facepiece respirators, like you see in the picture there, powered air purifying respirators, and elastomeric half mask respirators. We also focused our operations on existing approval holders, both domestic and international, and on new domestic applications. By focusing on those existing approval holders, we did not have to focus on new site qualifications. So that's part of our process as well, where we go into the manufacturer's plant and evaluate their quality assurance processes of their sites before we issue an approval. So the shortages were compounded by the fact that there are many manufacturers and manufacturing sites in other countries, and with the large number of COVID cases in China, early on in the response, the Chinese government took over a lot of the manufacturing plants. They were nationalized, so that made it difficult for healthcare facilities to get the products they needed. A lot of these products are manufactured overseas, and a lot of manufacturers, even in the US, had sourced some of the materials for their products from overseas. So that made it very difficult to get products into the US. We also saw an increase in the number of non-traditional manufacturers who were expressing an interest in obtaining approvals. And we had to put our heads together and develop processes to look at how we can address these new approval holders who may have quality assurance processes in place, but not necessarily a respirator quality assurance process. So for example, we had non-traditional manufacturers such as Ford Motor Company and Whirlpool and General Motors all come in to obtain approvals. But these approvals that we issued to them will expire at the end of the public health emergency. They have no intention on continuing those manufacturing lines. They were just trying to help out the nation when we had significant shortages. We also dealt with the Food and Drug Administration, who issued what is called emergency use authorizations, which allowed various respirators to be used that wouldn't typically be authorized by the FDA in healthcare. So manufacturers wanted to produce devices and help the nation now, but at this time, only with the FDA's authorization were these able to be used. So the public health emergency process that we developed resulted in a streamlined approach to the quality assurance requirements. And because, as I mentioned, that these established manufacturers have sound quality assurance processes in place, we were able to honor their quality assurance process and conduct a limited evaluation without compromising the quality of our approval to allow the products to get to market quickly. So these actions resulted in our filtering Facepiece respirator response times shifting from 60 to 90 days for an approval to 7 to 14 days. And then it also significantly increased the inventory of respirators across the nation. So since January, we have issued 701 approval decisions as of November 1st. And typically our annual calendar goal is 400 decisions. So next slide, John. So we also shifted our post-market activities. That's once a respirator is approved, we then evaluate the products and the sites to make sure they continue to meet the requirements of the approval. And typically we work on those devices that we approve. However, during the response, we had to shift to non-NIOSH-approved respirators because we also were authorizing these non-NIOSH-approved respirators to be used because of the significant shortages. And John is going to go into detail on these activities, but due to the shortages, we had this influx of respirators that were imported from other countries to address the shortages, and we initiated an evaluation activity to evaluate the filtration efficiency of these respirators. And since this activity was initiated, we have issued more than 400 reports where we've evaluated more than 400 devices encompassing over many different models and over 5,000 respirators that have been evaluated. And this work has helped to identify counterfeit and substandard products and get them out of the market. And we've supported investigations from federal agencies, from inquiries from hospitals and users. And John will talk about this more when he goes into his slides. Can you go to the next slide, John? So our research portfolio also shifted. We have a very rich research portfolio in healthcare and public safety. And in one case, I'm sure you've heard a lot about decontamination of respirators. So over 10 years ago, we had a portfolio in looking at how to decontaminate filtering Facepiece respirators, and that's the disposable one-time use devices that you see here on the picture. And we had a very rich portfolio 10 years ago and conducted a lot of studies, but at that 10 years ago, we determined that decontamination of these devices that were disposable was based on should be indicated on a manufacturer by manufacturer and device by device basis. So we stopped that research, and that's the way we left it. But once the pandemic started and shortages were occurring, there were many decontamination companies that were out there looking at vaporized hydrogen peroxide for decontaminating these respirators, looking at ultraviolet light, moist heat, many CO2. There were many different methods that were out there. So we dusted off our research. We started to update our guidance to say that some of these methods could be used, but again, it had to be on a device by device basis. And FDA also authorized some of these decon companies' systems to be used with products. So these activities are where policy and science merge, and the topics can get quite complicated and in depth. But we can, if anybody has questions about that, we can talk more about that at the end of the presentation. So also some other research underway had to be accelerated, and some new research topics emerged that were not on our radar. For example, looking at what the outward leakage of a respirator is, and how does outward leakage from a respirator with an exhalation valve compare to a surgical mask's outward leakage and to that of a cloth face covering, and what is the impact of the exhalation valve in filtering Facepiece respirators and elastomeric respirators, and what are the best practices across the nation relative to these topics. So these are research areas that we never were involved in before, and we had to start expanding our portfolio to include these as well. So can you go to the next slide, John? So another area is public inquiries. Since January of this year, we have addressed more than 5,000 public inquiries, and this is more than 13 times what we usually address. And you can see the increase in inquiries over the months and a steady decline over the past few months. But with, of course, the peak being in March, April, and May, where we were getting inquiries about every topic you can imagine with regard to PPE. And actually, these inquiries helped us to determine where we should focus our research as well. As the questions were coming in, we saw what the issues were in healthcare, and we saw where we needed to focus. For example, we had a lot of questions coming in the April timeframe that there was a shortage of fit test solutions. So we put together some science blogs to talk about how you can streamline fit testing to help address the fit testing solution shortages. That's also how we heard about the exhalation valve issues, and we started to explore that more. And now we have about 5 research studies underway to look at that. We also were seeing the shortage issues across other critical infrastructure workers because all of the respirators were going to healthcare. Saw issues with gloves as well, but there were many inquiries that have helped us to expand our research portfolio. Next slide, John. So we've also, as I started to mention, we developed a number of educational and translational documents to convey research and best practices. We've published a number of NIOSH science blogs that if you just Google NIOSH science blogs, you can find those. Those have focused on elastomeric respirators, on decontamination, as I mentioned, the fit testing solution, on the difference between masks and respirators. We've also posted a few videos and infographics, various toolkits, fact sheets, and web pages, and a number of Q&As as well. It's just this information overload right now, but when issues come up, we try our best to get information out there to address the needs of the workers who have the questions about PPE. Next slide, John. So one area we did not have a chance to update, but where we have a need is the enhancement of our PPE info database. So PPE info is a database of all personal protective equipment standards. And what we envision for this system is to enable all manufacturers to link their products to the standards that are in this database. And we started to do this during the Ebola response, where there was a lot of confusion about what gowns and coveralls should be used for Ebola. And so we have the Ebola as a hazard identified, and then we have a decision-making process where you can determine if you want to use a gown or a coverall, what the situation is, and then the standards to which those products should conform, and then all of the manufacturers who have products that conform to those standards. We want to do the same thing for the COVID response and also build on many other hazards in this database. And this is something that we actually have some of the Pitt staff who are helping us work on updating this. So next slide, John. So as I mentioned early on, we work in two primary sectors, the healthcare sector and public safety. So next slide. So just to summarize, what we've been doing with healthcare is primarily identifying guidance that will assist healthcare workers in knowing how they should be effectively using PPE and selecting PPE. We have some studies underway looking at the persistence of SARS-CoV-2 on filtering Facepiece respirators. We have developed some guidance that identifies a bagging method where each worker would have at least a minimum of 5 respirators that would be stored in paper bags. And then after you would be finished using one, the next day you would use the next. And that was based on research early on that showed that the persistence of SARS-CoV-2 was about 72 hours. So we did some research to validate that and found that indeed that is 72 hours is sufficient. And then again, the elastomeric respirators have been used in increasing numbers across healthcare, but something that isn't addressed by manufacturers is decontamination when exposed to viruses. So we've developed some guidance and have some work underway to ensure that the guidance is effective and to validate that guidance. We're also looking at working with Allegheny Health Network and University of Maryland to develop best practice guidance to help the nation in how they're using elastomeric respirators. Allegheny Health Network was the first health system in the nation who adopted the use of elastomeric respirators across their entire health network. So that was exciting for us, and especially since they're right in our backyard. And then also looking at respirators as source control, as I mentioned earlier, that's something we hadn't been looking at before. And then fit testing, and we have a number of projects looking at sensors to know when a fit is compromised, so that to hopefully one day we would like to do away with fit testing, so you would know when a fit is compromised instead of having to fit test. So next slide. And the other area is public safety. And next slide. And then, so these are just some of the activities that we've had going on. Public safety encompasses the structural firefighters, wildland firefighters, law enforcement, corrections, and EMS workers. And we've been working with them from a surveillance standpoint when the different organizations are going out and responding to a COVID case, for example. We are seeing what type of PPE are they using, whether or not it's been contaminated, and collecting that information to determine, if there are ever any changes that need to be made to their guidance, and what other areas we need to be focusing for this group of workers. That is all I have, so I'll just turn it over to John now to take it from here.
Okay, thanks, Marianne. So I'm going to begin my part of the presentation today just going over the international respirator assessments that we've been doing since the start of the pandemic. So before we get into the international assessments, I want to quickly share our conventional branch operations. So my branch is the evaluation and test branch. So we support the approval program, the respirator approval program, by conducting testing and post-market activities for that program. So under conventional operations, we would typically look at, filtering facepiece respirators, or FFRs, that you see in the top left. We would look at elastomeric half facepiece respirators, full facepiece respirators, self-contained breathing apparatus, as well as closed circuit escape respirators that are used in mining. So on this slide, I'm just trying to show you our conventional operations regarding N95 FFRs. So this is only for N95 FFRs. And like Marianne said, this is where we really had to focus our work, because this is where the big shortage was. So as you can see on this slide, we have 3 standard test procedures that we use for N95 FFRs. So STP3 checks exhalation resistance, STP7 checks inhalation resistance, and STP59 is the one we use that checks the particulate filter efficiency of the media that the respirator is made out of. I'm not going to go through all the requirements in the second half of this slide. It shows the requirements for STP59. One of the things I will note, though, is that we test 20 samples under conventional operations. We do 20 samples, and all 20 of those samples must pass our requirements before moving through the process. So when the pandemic hit the US, I don't think any of us knew how the PPE shortage was going to be affected. Normal supply chains and stockpiles were absolutely depleted, and we knew that we had to do something to help with the shortage. So we've worked with International Standards Organization. We knew there were other standards out there that were similar to the NIOSH regulation. Our regulation is 42 CFR Part 84. It's in the Code of Federal Regulations. And 3M, who's one of the major PPE manufacturers in the US, they issued a technical bulletin that showed the differences between these other standards in comparison to our regulation. And the table on this slide is actually an excerpt from the 3M technical bulletin. So to address the shortage, we developed some strategies to optimize the supply of N95 respirators. We came up with 3 different strategies, which included a conventional capacity, a contingency capacity, and a crisis capacity. Under the crisis capacity, we included respirators that were approved to these other standards in these other countries that we knew were similar to our standards. So what happened? Well, what seemed like overnight, the US market was flooded with respirators from China. So this slide is just showing a handful of some respirators from China, along with Korea. So a question that kept coming, a couple questions kept coming to us. One, how do these respirators compare to NIOSH-approved respirators? And the second one we kept hearing was, how do I know if what I have will actually protect me? So to help these workers out, we created what we call the International Respirator Assessment. We created a test plan, and we also created an online submission form. Through the form, users were able to submit products to us for evaluation. And the test plan we developed only looks at the filter filtration performance, and it's based on STP59 that I just discussed. We did make some modifications to the requirements, though. So one is we removed the preconditioning requirement. This would have caused an additional day to condition these respirators in our humidity cabinet. We also reduced the sample size from 20 that I previously said to 10. And we only run the test for 10 minutes. So we thought this was a good compromise. It would give us a good idea of the filtration efficiency, and we should be able to do the testing rather quickly. So as of September 30th, we have completed 443 of these assessments. This slide shows the distribution of the completed assessments by standard. Over half of the assessments are products claiming to meet GB 2626, and that is the Chinese standard for respiratory protective equipment, non-powered air purifying particle respirators. The next highest percentage of products have claims that they meet either GB 2626 or EN 149. EN 149 is the European standard for respiratory protective devices, filtering half masks to protect against particles. So combined, EN 149 and GB 2626 comprise 82% of the products that we've evaluated. So this slide shows assessment results by the international standard. Marianne kind of briefly talked about this earlier. So products that meet EN 149 or GB 2626 have very similar results. Approximately 40% have filter efficiencies that are equal to or greater than 95%, while 60% have filter efficiencies less than 95%. Products that claim to meet both EN 149 and GB 2626 only have 18% that are equal to or greater than 95, while 82% are less than 95%. We evaluated 18 products that meet GB 19083, and this is a Chinese standard for what we in the US would consider a surgical N95. So this is actually regulated by the Chinese government. So out of those 14 products that we evaluated, or out of the 18, 14 or 78% had results greater than or equal to 95%, and only 4 of those products were below 95%. And overall, we're seeing about 40% that are greater than 95 and 60% that are less than 95. So NIOSH always recommends that workers purchase respirators with traditional head straps. But what we've seen is 88% of the respirators that we've evaluated have ear loops, and it is very difficult to achieve a proper fit with ear loops. So OSHA, the Occupational Safety and Health Administration, their regulation 1910.134 requires that employers develop and implement a respiratory protection program, and part of that program includes fit test procedures. So preliminary NIOSH assessments, we were able to show that it is very difficult to achieve a proper fit while wearing a respirator with ear loops. And there are several agencies that attempted to do fit testing with these ear loop designs, and they told us that they also had a very difficult time achieving a passing fit factor. So at the bottom of this slide, there's a link, and this is just to the results page where all of the assessments are posted. I will note that if a manufacturer reached out to us and told us that the product we evaluated was counterfeit, they're listed on a separate table. So when you go to this results page, you'll see 2 tables there. So now I will cover some of the counterfeit and misrepresentation of the NIOSH-approved respirators. So all NIOSH-approved respirators can be found by searching the NIOSH certified equipment list, or what we call the CEL. This is the official listing of all NIOSH-approved respirators. To be NIOSH-approved, respirators must meet or exceed all of the approval requirements in 42 CFR Part 84. Once a manufacturer meets all of our requirements and receives their approval, the respirator is added to the CEL. Users can be confident that all respirators listed on the CEL have met the minimum requirements of being NIOSH approved. The CEL has different search features that can be used. All NIOSH approved respirators have an approval number that begins with TC. So for FFRs, that would look like TC-84A- and then followed by 4 numerical numbers. So when searching the CEL by a TC approval number, the results will also identify any private labels that are associated with that approval number. So what I mean by a private label is what some would call like a brand. So one manufacturer makes it but puts 10 different names on it. So those are what we refer to as private labels. If you search by TC approval number, and no results are found, that means that the approval is not valid and is not a valid NIOSH approval number, and it is not NIOSH approved. So this infographic on this slide shows all the required approval markings that are on an approved FFR. So the image on the right shows an FFR example with arrows pointing to all the required approval markings on the respirator. As I just mentioned, the NIOSH approval for FFRs has that TC number on it. So as you see on this one, you see TC 84A and then XXXX, which will be replaced with the approval number once it's issued. That approval, this information will either be on the mask itself, like you see here on the respirator itself, or some manufacturers will print this information on the head straps. So we always recommend that it's important to closely inspect your respirator and the packaging to make sure all the markings are identified. So we also maintain a counterfeit and misrepresentation webpage. So per our regulation, NIOSH only has authority to issue NIOSH approvals to respiratory products that meet our requirements. As such, our authority only extends to companies who hold the NIOSH approval. We have no control over companies selling counterfeit respirators or misrepresenting them as NIOSH approved. We report respirators falsely claiming NIOSH approval on this webpage. When we become aware of counterfeit respirators or those misrepresenting NIOSH approval on the market, we'll post them on this webpage to alert users, purchasers, and manufacturers. We use two terms on this webpage: misrepresentation and counterfeit. Misrepresentation applies to any unit, regardless of the manufacturer, that appears to mislead users to believe it is NIOSH approved. The term counterfeit refers to units trying to copy an actual NIOSH approved model. We include tips for spotting counterfeit respirators on this page. This includes looking for those TC approval numbers. We also provide some tips as to looking for things like decorative fabrics or sequins on respirators, any claims of approval for children, which we do not approve respirators for children, and if the FFR has ear loops instead of the head straps. Prior to the COVID-19 pandemic, the majority of the examples we posted on this website came to us through manufacturers who found that their products were being counterfeited. However, over the past few months, most of these examples have come from users and the products that they have been encountering on the market. The images on the right are screenshots taken from the webpage. The top row shows examples of misrepresentation of the NIOSH approval. The bottom left image is also an example of a misrepresentation. The manufacturer included the NIOSH name on the respirator, but they are not a NIOSH approval holder or private label holder. The bottom right image is a case where the approvals for this manufacturer were rescinded in 2017, meaning they are no longer approved, but products were still being sold on the market as if they were NIOSH approved. So this is a recent counterfeit example involving a product that is a private label, and that private label belongs to SAS Safety Corporation. It's the model 8617A, and it has the approval number TC 84A 4276. This approval number is no longer valid. The manufacturer rescinded all their approvals back in 2014. SAS Safety Corp, who holds other NIOSH approvals for other models, did not manufacture this product, and it is being sold without their permission. An easy way to verify this is to use the CEL. So on this slide, I use the approval number, TC 84A 4276. I put that into the search box. And when you conduct the search, you view results, you get the box to the right, and you see where it says there are total approvals found equals 0. So this is a way you can validate that approval number. And in this case, the CEL tells you that it is not NIOSH approved, and that is not a valid product that should be used. So my last slide, I don't know if you guys will get a copy of the slide deck or not, but the last slide is just links to everything I talked about. That concludes my portion. So let me stop sharing.
All right, thank you both. So I knew I would learn a lot, but it raised a number of questions for me, and I'm sure for others, other attendees. So I want to encourage people to use the Q&A to ask those questions. I'm going to start one off though, and I think either one of you, if you could talk a little bit about the difference between respirators and what it is that we as the general public are wearing, right? So I'm constantly in search of the perfect mask, but for me, it is about fit and comfort, but sort of what do we know about all of that range that's out there, and then what's the difference with the different type of respirators that you talked about? I don't know, Marianne, do you want to start us off?
Yeah, sure. That's a really good question, Jessica. So the general public is using the devices primarily for source control. And what is recommended in the CDC guidance is cloth masks, which are unregulated devices. So they do not have any particular filtration efficiency requirements or breathing resistance or fit requirements. So, there are a wide variety of, you see everything, people make their own. What CDC is saying that the more layers, the better. But of course, you don't want too many layers, because if you have too many layers, then you're not going to have the breathability that you need. So right now, when cloth masks are used, they're used for that source control. So you are wearing that device not to protect yourself, but to protect the other person, and it captures the large droplets, not the smaller particles like a respirator would. So the regulated devices, the respirators that we approve, capture over 95% of the most penetrating particle, which is at the 0.3 micron level, so the nanoparticle range. But given that they capture those smaller particles, they will capture every other particle because that is the most penetrating particle. So hope that helps.
That does. I do have a question about, so people who wear the N95 masks out in public and then leave them in their car and reuse them and use them again when they go into the grocery store. Is there guidance about that piece? Because those are the respirators, but they're reusing them over and over.
Yeah, so right now CDC is not recommending that the general public wear respirators because because of the shortages, they should be conserved for healthcare workers. So the guidance for CDC right now is that you should wear cloth masks when you're within 6 feet of somebody else. So and our guidance when it comes to reuse in a healthcare setting is that you should don it no more than 5 times. So you should, because the fit is likely compromised after you take it off and take it on, because these are disposable devices, and when you're taking it off and on, the fit of the device may be changing, as well as the elasticity in the straps. So we're recommending no more than 5 donnings for healthcare personnel who are wearing these in a workplace setting.
So that leads well into a question that we just got, and one that I had as well, is about I'll just read the question off, but does the certified equipment list include respirators on the market or just respirators available to the healthcare industry? And this attendee notes that they purchased some KN95 masks for personal use from a website and wishes they had heard this webinar before doing so. So that's one question about the CEL. And then the other follow-up is that issue of fit that you just raised, right? That some of those have the ear loops, and so maybe they're not a great fit. John, is this something you can sort of touch on both pieces?
Yeah, I can do both. So the CEL is all respirators, all NIOSH-approved respirators. Is not just specific to healthcare. In fact, healthcare is a whole other issue when it comes to respiratory protection, because FDA has authority over healthcare and what they can and cannot use. There are N95s that are designated as surgical N95s, and they will have that additional designation on them. So that means it's NIOSH-approved, as well as cleared by the FDA for the surgical requirements. So there's 3 additional requirements they look at. And in the future, we, NIOSH, will be performing those, looking at those requirements. We have a memorandum of understanding with the FDA, where instead of going to both agencies to get an approval for a surgical N95, the FDA has granted us the authority to do that on their behalf. So we will be looking at those requirements in the future. But it's all respirators are on the CEL. I would just say, folks buying KN95s, use the link, go to our results page. There are some very good ones that we've evaluated. So I would say go to that results page we have, find some that are 95% or better, and then see if you can find them. So just be leery what you're buying online, and also be leery that what you think you're buying and what you get is the same thing. Because we've had lots of people tell us that they think they're ordering. A lot of the investigations that we're involved with the other federal agencies are exactly that. They are posing as buyers. They're buying what they think is X, and when they get the package in the mail, it has Y inside of it. It's not what they thought they were buying. So just be careful, and be careful of websites claiming that they're a 95 equivalent or that they meet all these other requirements, because it may not be true. So for fit, yeah, Fit's more of a thing for workplaces, because it's regulated by OSHA, but there's a full procedure that happens with your staff for achieving fit, right? So you have to look at different face sizes. You have to offer different models, and if those models have multiple sizes, you have those multiple sizes available. And what fits me may be different than what fits you, may be different than what fits Marianne. So we would all have to go through that program. We get fitted to our particular respirator, and then we do our jobs, right? Well, one of the things that happened under COVID is those respirators are no longer available. So all these workplaces, just not in healthcare, but construction workers, they're fit tested. Anybody who wears a respirator as part of their job is fit tested. So they all had to start pivoting and looking at other things available. So we found, and just working with other folks, we did a little bit of testing on our own, but we got it from a lot of folks out there, a lot of state agencies that were buying these things and then trying to hand them out to first responders and fire departments within their state, and immediately started doing fit testing and would call us up and they're like, hey, we can't get these things to pass a fit test. What are we supposed to do? And of course our response is try to find head straps, try to find NIOSH-approved. That's what you got to do, what you got to do. And that's in our book, that's what you have to do, is have those head straps. The head straps just provide a much tighter fit than you get with your loops. So it keeps it pressed up against your face to make that seal.
And so there's a question here about, is that as important when you're thinking about these, the cloth masks that people are wearing? But does the type of strap matter, right?
Yeah, so it's different, because like Marianne said, the cloth face, so I'm going to start using different terms too, right? So we have respirators, you have masks, like a surgical mask or a procedure mask, and then you have what we call the everyday face covering that everybody's wearing, right? So for source control, the fit's not as big of an issue, because the particles are much bigger, much larger than what a respirator is trying to stop. And that face covering does a really good job of stopping those particles. Even though it's not tightly sealed against your face, it does a really good job of doing that. So it's a different issue, right? So I wear a respirator because I'm protecting myself from what's floating around in the environment. I don't want to breathe it in. Let's say like asbestos. So I want to make sure that those real tiny asbestos particles aren't coming in around the edge of the respirator, and then I'm breathing them into my lungs. So that's why fit's important.
And then the cloth mask, you also want several layers. If you're just wearing a bandana with one layer, then you're not going to be, more particles may be getting out of that, the larger particles. Saying at least several layers.
Right.
It's in the guidance.
We have, so there's some preliminary work we're doing with another one of our divisions here in Morgantown, where we're looking at the cloth-based coverings, and the very popular gaiter that we see everybody wearing is not the best source control out there. The actual like cotton cloth-based coverings do a much better job at stopping those particles. Even when the gaiter is folded in half and you may fold it over and have 2 layers, the standard cotton cloth-based coverings doing a much better job at stopping particles for source control.
If I could go back to the KN95 piece, another thing that I think we did mention in the presentation, but if you're looking for a good KN95, looking at the results that are posted, but also the FDA emergency use authorization list, all of the ones on that list are ones that we have evaluated for FDA to demonstrate that they do meet the requirements they claim to meet. And again, like John was saying, you have to make sure you have an authorized distributor, because there's so many distributors out there who are packaging, they may put 10 good products in with 100 bad, but so you'd never know what you're getting. You have to really be careful.
Yeah. And that's another good point for healthcare. So the FDA emergency use authorization, or what they refer to as an EUA, that governs what healthcare is allowed to use. It actually authorizes those products for use by healthcare. So like Marianne said, they have a webpage. They have, for China, it's referred to as Appendix A. So they have a link there on their webpage. You can look at Appendix A and you can see all of those products that they are authorizing to be used in healthcare. And like Marianne said, we've tested those collaborating with the FDA. And then they have another EUA. So there's an EUA just for China, and there's another one for all other countries. And for that EUA, they refer to it as Exhibit 1. So then you go look at Exhibit 1 and it'll have a handful. It's not as lengthy as the Chinese list, but it'll also provide you with other options from other countries.
That's a great resource of information, and a lot of work that I'm sure went into that. So there are a couple questions here about, is there still a shortage of N95 masks for health professionals, is the big question. And then are there these sort of counterfeit masks? Let's use the right language. It's a respirator, right? Circulating in the market, and what does that mean for healthcare providers?
So I'll go to the shortage topic. So we are hearing that there are shortages still. We don't know if they're real shortages or if people are hoarding, or if it's just that people are unable to get the products that they typically get. Because we have been reaching out to all of our new approval holders, and some of them are saying they have not had any sales yet. So I think it's more that, someone who typically has a 3M product cannot get as many 3M products as they need, but they don't want to go to one of these other products that are out there. So that's what I think it is. I don't think it's a true shortage. I think people just are not aware, and we're trying to figure out how to get our messaging out there so people know where they need to go to find these products. But I don't think it's a true shortage. It's that people don't know where to get them.
Yeah, I agree with that. And then for the counterfeit, counterfeit's a tough one for me, because there's truly counterfeit, and then there's just bad products out there, right? So there's just bad products that are claiming they meet certain things, and they just don't meet it. That doesn't mean it's necessarily counterfeit. It just means it's bad. And they're misleading, buyers by saying that it provides this level of protection, but it may not. So you just have to be very careful. I mean, so it goes to the shortage question, but if you really need a respirator and you really want to know, you have to get NIOSH-Approved. You just have to.
Mm-hmm. And we've conducted some webinars also that are online that describe this in more detail.
you read my mind in terms of a question was, I think many of the guests that we've had on here have talked about, the science is evolving quickly and we're learning new things quickly, and sort of how do we effectively communicate that to each other and then to the general public is a particular challenge. And so you mentioned just now webinars. Earlier in your presentation, Marianne, you talked about science blogs and educational and translational documents. Can you talk just a little bit more about how your group connects with the communication side of things and the efforts that are ongoing to share, even the language that you were just helping us to get clear in terms of respirators, masks and surgical masks and face coverings or face cloths. That's important language, and we're all struggling to make sure that we're using the right words so that we can understand what they really mean. So if you could just talk broadly about how that happens within your group.
Sure. So we have a communications team, and that communications team in NPPTL works with the NIOSH one, who works with the CDC one. And all of those teams have partners, and we have partners as well across industry sectors, across unions, for example. So the AFL-CIO and their member unions, we meet with them and have webinars with them or provide them different documents and links. We've met with the American College of Occupational and Environmental Medicine and had several webinars with them. Different industry sectors, the healthcare sectors, public safety and construction sectors as well. So all of those communication vehicles I mentioned are what we try our best to communicate in science blogs. When we see a hot topic, we usually put a science blog out about it. And then we also have a listserv, and we have thousands of people who are on our listserv, and we send out notices. We try not to send them out too often because then people have notice fatigue. So only when there's some important change, we send those out. And we have an elastomeric webinar coming up. And so I think it's the HealthComm team has that. It's their process that's used, and we share the information that we believe needs to be shared, and they have ideas, and every day more communication vehicles are being identified. But if anyone has any ideas, please let us know.
Yeah, right. If they have ideas. And then also I think, I was just looking at your Twitter feed too, has some really important information in it, and to follow that if we want additional updates. So sadly, we are running out of time. I just have one quick question and then I'll wrap it up. There's a question about price caps and the prices. Can you comment at all about the cost of some of these respirators, and as the demand goes up, is the price going up too? I don't know if that's at all in your wheelhouse.
Yeah, you want to talk, John, and then I will.
So I will tell you that I would say probably 50% of the investigations we get involved with are started by cost. So it's not what we call a price cap, it's price gouging. So of course, companies, individuals are trying to take advantage of, the situation. So there's a shortage. They purchase or were able to get their hands on, a bunch of respirators from China that were probably purchased for less than $1 a piece. And then they're selling them online for, a 5-pack for, $50. Those are little things you can look for, right? If you see that, don't buy it. Stay away from it. So it's to me, it's not that there's a price cap. I mean, manufacturers, in the US, are free to set their own pricing on their products to, make a profit and recoup their costs. But for these devices, for disposable FFRs, they're relatively cheap. You see them for anywhere from $2 to $3, $2 you know, on the market. You go to Lowe's, you can buy a 2-pack for, you know, $5 or something, $7. So definitely be on the lookout for those higher prices per unit pricing. That's definitely a tip off that something's not right. You should stay away from it. But yeah, I don't know. I wouldn't say price cap. It's just, you know, the market is usually fair. And I will say that I don't believe the US manufacturers or the NIOSH-approved manufacturers have raised their prices due to the shortages. You know, they've actually are increasing their capacities and trying to get as much out there as they can. I mean, they're still, from what we had heard early on is, you know, they just fell way behind filling orders. And then they were getting additional orders on top of that. So they just really got behind, and, you know, where they were at their capacity as far as their production lines went. And they've been really good. I mean, a lot of the big ones, 3M, Honeywell, they've all added additional sites within the US to make more. So
That's great. Marianne, did you want to add something there, or?
Yeah, I don't think I have anything to add except that we also work with Amazon. So when we see, or if they see price gouging, so we tell them what the prices should be, and if they see price gouging, they let us know, and then we, that's part of the process as well.
That's great. So thank you for covering a pretty broad topic for us and answering all of our questions. So I really appreciate you both joining us today, and to all the attendees and for this discussion. I hope people will join us again next Friday. It's the last session for the seminar this term. And it's got a catchy title: Disinformation, Misinformation, Politics, Pandemics, and Public Health. And so I really hope that everyone will join us again next Friday. And again, thank you for joining us, and have a great evening. So thanks a lot. Take care.
Thank you.
Thank you.